स्टार्ट किया है, लाइव स्टार्ट किया है आपके डाउट्स क्लियर करने के लिए. यू कैन आस्क योर डाउट्स इन द चैट बॉक्स. दूसरी बात मैं बता दूं कि आई एम गेटिंग पॉजिटिव रिव्यूज़ अबाउट द बुक from many doctors who have purchased it, and they are reading from it actually and getting benefited. बट 2-3 पीपल है ना, हर जगह 100 में से 2-3 लोग तो ऐसे होते ही हैं जिनको इम्पोर्टेंस समझ नहीं आती किसी चीज़ की, तो वो फिर झगड़ने लग जाते हैं व्हाट्सएप पे आके. भाई तुम्हें बुक नहीं चाहिए तो मत लो, किसी ने फोर्स थोड़ी ना किया है बुक लेने के लिए, है ना. तो बट मैनी पीपल हैव seen the book and they know what this book holds. Okay, so let's start the session. And this supracondylar humerus fracture, it presents with the gunstock deformity. Then violence against RMP is a cognizable and non-bailable offense. Lactational mastitis source is infant's nasopharynx. Boxcar or bamboo stick appearance is seen in Bacillus anthracis and Medusa head appearance. Then primaquine is gametocidal drug. Then HIV or heart drug causing deranging the lipid metabolism is indinavir. Then cardioselective beta blocker with antioxidant property, it's nebivolol. So you can ask your doubts in the chat box if you have any doubts. Then erythema migrans or bull's eye rash, it's seen in Lyme's disease, and amoxicillin is the treatment of choice in children and pregnant women, and in adults the treatment is doxycycline. Then is the Porter syndrome. Porter syndrome, we get bilateral renal agenesis, pulmonary hypoplasia, oligohydramnios, Porter syndrome. Then Cowdry type A inclusions are seen in herpes simplex. Then unstable PSVT, treatment is synchronized cardioversion. Then if the tumor is more than 5 centimeter, it is the locally advanced breast carcinoma. Then nuchal translucency scan is done between 11 to 14 weeks. Yeah, Jyotika is asking that did you apply for INSET counseling? Yes, I applied, and I was getting a paraclinical branch in AIMS Rishikesh, so I didn't opt for that. Okay, I will take a radiology or dermatology from the NEET PG. Because in AIMS seats are very less, and up to 200-300 rank you will get the clinical branch. Okay, in NEET PG at 1400 rank you will get MD radiology, medicine, derma, and surgery, medicine, everything you will get if you get under 2000 rank in NEET PG. Then a nuchal translucency scan done between 11 to 14 weeks. So all these MCQs are taken from the GT review book. Okay, so blood vessels do not penetrate the epidermis. Teduglutide is a GLP-2 analog which is used for short bowel syndrome. Then loading dose of MgSO4 is 4 gram of 20% solution or 8 ml of 50% solution. Then is the this Zellweger syndrome or cerebrohepatorenal syndrome. Long chain fatty acid accumulates. Then Heller cell is situated at the roof of maxillary sinus, and Onodi cell is a posterior ethmoidal ear cell. Then prucalopride is a 5-HT4 agonist, and it causes increased bowel movements. Prucalopride. Then non-scarring alopecia. Non-scarring alopecia with perifollicular hemorrhage. What is the diagnosis? Non-scarring alopecia with perifollicular hemorrhage. It is the trichotillomania. Trichotillomania. Then Simpson fascia is attached to the inner border of first rib and the vessels pass above the Simpson fascia. You know that anatomy question, 8 to 10 questions of anatomy were asked in NEET PG 2024. Never underestimate any subject, okay? Then S-shaped deformity of the upper lid. S-shaped deformity of the upper lid. The answer is no. This any if someone is asking, you got medicine at 1413 rank. It shows medicine aims pretender. No, I was getting paraclinical branch in aims. In 1400 rank, you will never get the clinical seat at aims. Clinical seat at aims is up to 400 or 500 only maximum. Okay, so I didn't opt for it. I will opt for radiology or dermatology from the NEET PG. Exact rank is 1413. That's what I wrote in the on the book also. You were, I think you were checking another, means check the July 25 list. Confirm firstly whether it's of July 25 or not. Then is the S-shaped deformity of the upper lid, plexiform neurofibroma. Then hand glider sign, dark triangular biting apparatus. It's seen in Sarcoptes scabies. Then is the Ebola virus belongs to Filoviridae family and bowl of spaghetti appearance is seen. Okay, so one thing someone was asking me that whether we can complete this book in these many days. So let me tell you, 18 days are left, and if you do 40 pages of book every day, which won't take more than 2-3 hours, and then you will complete this book in 15 days. So that is these things are to be done in last days. No theory reading is suggested at this time. Do MCQ practice, review the GTs, attempt the GTs. That is the strategy in last 20 days. Then is the patient with cardiac tamponade is asked to breathe normally to elicit the pulsus paradoxus. Okay, someone is asking how you remember the random facts. Actually, these are not the random facts. Firstly, these all have been asked in some exam or the other. Means in some previous NEET PG or INISET exam, they were asked. These questions are asked, and they are typical questions. And many questions were from this notebook or your notes. You can say many questions for. I only revised this book only made by me in the last 4-5 months. I was revising only this book and the BTR. And things become easy. Many of the questions I already knew the answer. For example, the tetanizing frequency, it was multiple time asked in the marrow gland test, and I wrote in this book that they will give you the relaxation period, they will give you the contraction period, है ना? तो tetanizing frequency is 1 by contraction period. Okay, so that the things become easy somehow. And then the eye of tiger sign, you remember in INISET. So it is seen in Haller-Warden's part syndrome or the pentothenase kinase. So things become easy. That was also in marrow gland test. Then the dog ear question was there, image was given and identify it. So rest three I knew, they were given in the marrow gland test, and The last one, this dog ear, I didn't knew anything about it, but I'm sure that these three are not the correct. So I marked the last option and that was correct. Okay, and one thing is, in the Iniset, in this book, if you purchase it, then you will see that there is Iniset. At last I have added the Iniset reviews, Iniset test reviews, and then on the first page of Iniset register, in the first page there were three MCQs. I wrote three MCQs from the GT reviews, and those three MCQs came in the Iniset exam from the very first page, and I got two out of three correct, and I was like, why I didn't revise it more efficiently. So this bridge population was asked in the uh, that was question, and I got it wrong actually, and it was on the first page of my Iniset review uh, book. So I have compiled NEET PG and Iniset both here. For example, the Vibrio parahemolyticus was asked in the Iniset. That was asked in NEET PG to 2024, and that appeared in the Iniset May 25. So Iniset question may come in NEET PG, NEET PG question may come in Iniset. Okay, so means do maximum question, review maximum GTs. So that is why we have created this book, because if you attempt one GT, then it will take 3.5 hours. Then you will rest, and then after that you will review the it. So it will take whole day. So to review the 100 GTs, you require 100 days, but we have only 15-18 days left. So to make the thing, make the save the time. Time is money. Save the time. We have just published this book. I was not ready to publish it because it was my own notes, but many friends and batchmates were asking for it, so I published it. Okay, so it's on your, means it's up to you how efficiently you use it. Okay, Shweta is asking, send your number. Actually, I'm not sharing the number on YouTube. Okay, because many no, this many people are there who will misuse it, so I have provided my number in the Google form. Yeah, it's there. See the Google form, it's there in the Google form, and WhatsApp me on that number. Actually, is it necessary to do bonus BTR and compiled modules? I don't know what is bonus BTR and compiled modules. I know only BTR, it has two volumes, uh, wrote by Dr. Zanavora, and it is quite good. I have myself done BTR two times, and I don't know what is bonus BTR. Okay, so continuing about this gold criteria for COPD is very important. Mild COPD means more than 80% FEV1. Moderate is 50 to 80%, severe is 30 to 50%, and very severe is less than 30%. Okay, so uh, Shweta, my number is there on the in the Google form. Okay, many people are what doing WhatsApp. Link of the Google form is in description box. Description of box of this book's videos, in today's videos also and yesterday video also. The Google form is linked in the description box. You can you will come to know how to just purchase the book and what is the process. Then then is the forceful expiration. It is the function of ventral groups of neurons. Then is the less than 28 weeks fetus, or you can say less than 28 weeks. If means preterm baby is there, so IV fluid is given. 28 to 32 weeks oro gastric tube. Then 32 to 34 weeks Paldai feeding is done. More than 34 weeks breastfeeding. Then PK is asking, sir, I feel that I'm missing my notes, and in FOMO that I will forget all written stuff. Okay, so that this is a common fear or FOMO. I don't know what is FOMO. People were telling me that we are having FOMO. Then I came to know what is FOMO. So FOMO is when you do not do the question practice. If you do the question practice, if you have done 20-30,000 MCQs, so why you will fear? The exam, NEET PG exam is easier than the grand test. Actual NEET PG exam is easier than the grand test. And this time INICET was also INICET was also important. Important means it was easier than the grand test. So why FOMO? Just give the grand test, review the grand test, and then your fear will decrease and you will not have FOMO. Because you have not done the MCQ practice now, that is why you are fearing. You, if you are fearing which MCQs will come, the MCQ will come only from the previous year and your studied stuff. Mohammed Mustafa is asking sample. The sample, for the sample you have to just WhatsApp me on the number given in the Google form. The Google form link is in the description box, and then Google form is in the description box, and you can just see my number in the Google form. Then is the I want to he's asking, I want to ask that when we review GT question in one line, what about explanation? Actually, why you are running after more and more explanation? You don't have that much time to read all the explanation. Just see what his question is asking and it will be finished in one line. For example, I tell you, what is the drug of choice for northeastern states? Plasmodium falciparum. So the answer is artemether plus lumefantrine. So why you are studying all the stuff that is given? It will take much time, okay? Then Walid doctor is asking, what's the approach for anatomy and physiology? For anatomy and physiology, you will have to read the main notes. These basic subjects, reading the main notes is more important than the question practice. For the clinical subjects, third year onwards, third and fourth year subjects, for them you need more clinical practice, and maximum stuff is from third and fourth year subjects. Okay, so you need MCQ practice, sorry. MCQ practice is for required for clinical subjects, and this anatomy, physiology, biochemistry, you need to read the main notes. And they are short means very short subjects, they are not large subjects. You can complete anatomy, physiology, biochemistry in 4 or 5 days. Okay, then what about atypical doc is asking, what about the tables for exam, any cancer breast treatment, they ask about particular stage. Actually breast is asking much, means 5 questions were from the breast in INICET. So breast is the golden topic. You have to learn all everything about the breast. Then how should we approach for that? And reviewing GT or going random modules, which is better? Reviewing the GT is more important. This question bank, marrow question bank, doesn't have that much good question as compared to the GT questions. Marrow GT questions are fabulous, means they will boost your score actually. Then PK is asking, sir, should we leave an at physio and I? Why you are leaving an at physio and I? Why you are leaving any subject? Okay, so do all the subject, and I am just stop streaming this live video. You can ask your doubts in the comment box. Why you are leaving the anat physio and I? Anat physio and I are important. Best possible way for last 19 days. In the last 19 days you have to do MCQ practice multiple time. I have told. Why you are reading much theory in this phase? Any weak subject you can just read from the notes, but the main core strategy is doing attempting the GTs and reviewing the GTs, and do maximum question practice in the last days, revising the BTR, revising the GT review book. That is the strategy. Means going through more and more MCQs is the strategy. Okay, so thank you for joining in this video. If any doubt is there, you can ask in comment box.